Welcome to this season of Let's Talk Value. It's a uniquely version of this podcast series that we've been running for a few years because it will feature our next book, The Next Tango, that I had the honor to co-edit with my fabulous co-author, co-editor, and fellow in crime, Hanna Boëthius. Welcome, Hanna.
Thank you so much. Hello, co-editor, co-author, co-everything. How are you?
My name is Verena Voelter, and I'm the CEO and founder of 5P Healthcare Solutions, as well as Hanna said, author of The Next Tango. And we have a series of fellow co-authors for this version of the Tango book, but we'll get into this. Really hang on a couple of minutes. We'll be there with you shortly on all the content and what you can expect from it. I just want to say that as the sponsor of this season, actually, 5P Healthcare Solution is a boutique consulting firm, and we're actually experts in the field ourselves. We bring decades of frontline experience as doctor, as patients, as pharmaceutical experts, as hospitalists, as startup entrepreneurs. And what unites us is the theme of collaboration and breaking down silos. So let's dive into it. I have a burning question to you, Hanna. What brought you into this, of all places, idea to write a book?
Well, thank you very much for that very interesting question. I I mean, I've had several book manuscripts ready on my, or not ready, started on my computer for many years now. And here came an opportunity that came along, and it was just too perfect to say no to. So I couldn't. And here we are. Now we have a published book, and very, very proud and very overwhelming feeling as a first-time author. But it's very cool to see your name on a book, I have to admit. But
Little kind of,
what about you? What about you?
well, well,
What
well,
compelled you to write a second book?
yeah, I don't know. I don't know. I should say, and probably the answer lies in the introduction, because you as a reader and listener, you can read a dialogue between Hanna and I think it was what, Hanna, December 23, time
Yeah.
flies, where we had a dialogue and kind of the answer lies in there. So I keep the readers a little curious. But I wanted to do now is to read actually one of our testimonials. So we had a number of really helpful people that supported us to bring this to life. And that's part of these answers, like how did we even manage to write a book? Well, we didn't do it alone. You heard we had co-authors, but we also had really wonderful people who read manuscripts and gave ideas, etc., and who were critique also. So let me read you the testimonial of my mentor, actually, in the collaborative negotiation, Charles Barker. Here's what he says. With the Next Tango, Mrs. Boëthius and Dr. Voelter and co-authors foster greater understanding among all stakeholders of patient interests in healthcare. Not as the other stakeholders want to understand them, but as the patients themselves with wish subjectively to be understood. This empathetic appreciation expressed through each of the other stakeholders' perspectives, hashtag 5P, is essential to unlock the full potential of healthcare system that today actually rapidly evolves with burgeoning change in science, public policy, and finance. A stakeholder who can readily and sincerely inhabit the patient's point of view can not only generate more value for the patient, but enlist the patient's cooperation for the benefit of the whole system. We all thereby raise the standard of care for one another. So, music to our ears, Hanna, isn't it?
Definitely music to our ears. And basically, he summarizes the whole book in a good little paragraph, because this is really the structure that we have been working on for so long with this book now. We have uh, the 5 Ps, each have a chapter, and the 5 Ps are then patient, provider, a pharma, policy, and payer. And then we have a special little one at the end, which I'm actually most excited about. But anyway, and all of them are written by experts in their fields, and they share sort of their views on how to better collaborate within healthcare, how to bring more care into healthcare, yay, as well as how we can, through that, also reach better patient centricity amongst all of us.
Right. And so and we'll sprinkle in a couple of quotes as you've already heard us read and say certain things that we have summarized. And there is one that Hanna and I wrote when we redacted the preface. What makes the Next Tango unique is the wonderful set of voices provided by experts in their field. And we feel fortunate to be part actually of that growing community. We should say of writer, author, healthcare leader, experts that really collectively try to break down those silos. So Hanna, can we reveal who those co-authors are?
Ooh, are you ready? Well, along with ourselves, we have co-edited it. I also have, and you've actually dabbled in a lot of of the chapters actually as a bit of a co-author. So I think that's very valuable for the whole coherency of the book. I write the chapter on the patient view, and then we have Claudia Witt and Claudia Canella from the provider side, writing about how patient centricity and participative research, how that is going in their projects. Then we have Nike Fenstra, who is a pharmaceutical leader. And then we have Caitlin Masters, who is a long-time value-based healthcare expert, sharing her experiences as well in chapter 4. And then we
we
have
need to
Paul
keep counting, right?
Yeah, I'm 1, 2, 3, yeah, 4. And then Paul Sherrington in chapter 5, talking about his experiences and his expertise. And then we have Suzanne Robinson and yourself in the very special 6th chapter.
Yeah, and I just want to say one thing content-wise, but I'm not going to belabor it too much because it's for everybody to read it up and tell us what you think about it and hashtag value-based healthcare, because it's all about patient centricity. And then in a minute, I'll turn it over to actually ask Hanna a few questions about her chapter 1. But bear with us 2 minutes. So VBHC, patient centricity, a patient guide, because that's the subtitle of the Next Tango. It's a patient guide, all you need to know to deliver great results in healthcare. So just introducing actually that famous equation by Michael Porter 20 years ago. Value is created when you deliver outcomes at the best and most efficient cost to actually deliver those outcomes. So a couple of quotes from the book, and then Hanna can give us really her patient-centric view and perspective on that discussion. So the first one goes, let me find it in a second. Here it is. On the other hand, by the way, you should think we know it by heart by now, right? But we don't. So let me read it. On the other hand, more often than not, patients are still not consistently at the center of the proverbial round table that, parenthesis, Hanna has already introduced in the first tango, and the care coordination team, because today hospitals are still being built and build around silos, departments that suit the administrative flow better than a patient's journey. So what value-based healthcare does, and that's what we do in our day job, in a 3-step process, you just need to define a really good patient population that shares the same needs. For example, diabetes, I'm already revealing a piece of chapter 1. And then you will set with all actors required, and that's not only the clinician that you need and the nurse, but also maybe for a type 1 diabetes, the school, sport, nutrition, coaches, etc. So you have a condition, you map the actors, and then guess what? Everybody discusses what the desired outcomes should be. But you cannot do it without the patient, and you should ideally put the patient view as a first step together with the others around. So the other quote in the introduction goes, value-based healthcare holds the power to break down silos along the patient journey because it pulls together all actors needed to deliver best possible results that matter to patients, and it brings everyone onto the same page. So without further ado, Hanna, chapter 1, the patient
Chapter
perspective on
one.
what we need to deliver great results in healthcare. Tell us more.
Well, chapter one is really well, it's something that we've been working on, of course, for years, just within 5P, but also something that I've been developing for years on my own and in my own sort of activities and whatever I've been doing in the past couple of years. And really, the main focus of the chapter is how much we as patients can really contribute towards our own health and our own care, and how we also, we're not just passive, we can also bring more health and more care into healthcare. And I think this is a really important point because sometimes that goes amiss and you are sort of at the realm of everyone else in the healthcare system.
And I want to introduce the hashtag self care. And I really love the beginning, what Hanna writes to bring us into her world. She says, growing up by the ocean was one of those incredible privileges you only really appreciate once you no longer live there. The smell of the salty water, the sound of the waves, and the occasional ray of sunshine on your face, bliss. The truly my happy place still today. Talk about self care.
Yeah. Yeah, because this is really the one of the central themes in the book. You know, self-care, that's how we start the introduction. We're not going to reveal details. You can read it yourselves. But it really is self-care and how much we as patients, but also of course everyone else, but now we're talking about patient centricity, so why not? How much self-care really matters when you are, for example, a patient of the chronic variety and not getting no end in sight, but you still have to keep up momentum and keep up your motivation. So self-care is a huge cornerstone of that.
So, can you just and we'll, as you say, we're not going to reveal the whole book here because this is like a short podcast, but I think there's three concepts. I think it's great for the readers already, tease their excitement. You have you categorized it really nicely. I mean, patient centricity is a big theme, but there's other themes around empowerment and literacy. Can you help us how you actually structured your chapter?
Absolutely. So in chapter one, I talk a lot about three concepts, and this is self-advocacy, this is patient centricity, and patient empowerment. And they're all slightly different, although they sound very similar, especially to someone who might be new to all of this. But for the sake of brevity and a short introduction, self-advocacy is really that you, as the patient, actively participate in your own care, which is so important because who else is going to advocate for you? No one is really there unless you have some superhero family member or friend who can do it for you. The patient centricity part is really the healthcare system's commitment to deliver the care that you need. And patient empowerment is the whole healthcare system really enabling patients to take control over their own health as well, because we all need the knowledge, we need the skills, and we need to also have a good load of confidence to be able to do this. And there needs to be space for this as well. So I think I think we're all of these are also pointing towards the more collaborative way of providing care. And I think that's another big theme in this book, right?
Absolutely. Can you help us with one question that you and I and our colleagues get not daily, but very frequently in our day jobs when we say, or when people say, oh, yeah, value-based healthcare sounds really good and actually makes sense. And I've read books and I've seen it elsewhere. But what does outcomes that matter to patients really mean? What's your answer to this question?
It's a big loaded question for such a small podcast episode, but
It's like a
in
six
short,
months mandate, but okay.
but just to get the conversation started, and maybe if you have other views, please let us know somewhere in a comment or an email, and we can happily talk about this later as well. But I think this is really an quite an individual view on what matters to that patient. It's really the right treatment at the right time for the right person, right? And I think you alluded to another aspect of this a little bit earlier, and this is really where we all come together and we all work for the same goals, and that we co-create these goals together. And it's not, a a ruleless ping pong ball game without any boundaries is really that everyone is involved, and we can co-create these goals together. And I think there's one or two pictures in the book as well that speak a lot to this, and I think they're quite funny. So also don't forget to check those out while you read it.
And before we go to sorry, go ahead.
No, go ahead.
Before we move on to the kind of the last nugget that we wanted to share from chapter one reflection on that outcomes that matter to patients, it is not only clinical. So we, of course, medicines and therapy, and I'm a cancer doctor, so chemotherapy is important, radiation and surgery is very important. But sometimes and we all have seen it when we say, oh, I have a headache, and then we go to the doctor, it doesn't go away. We get painkillers, it doesn't go away. And then maybe digging deeper, we feel, oh, I'm actually missing sleep, and I actually have an issue with my child at school. And I actually am so busy in my day job, I don't have time to deal with it. So let me take a quick pill. But at the end, maybe people figure out, oh my goodness, I did this meditation course, I did actually a jogging class or a yoga class, and all of a sudden the headache goes away. And then you go back to the doctor and say, no, I actually don't need a refill of this painkiller because I found my set of activities that actually alleviate my pain. That is what outcomes that matter to patients. But you only figure this out in a care coordination team. And not everything can be discussed between your doctor and yourself. Maybe much of it, but not all of it. So let's not forget societal elements and emotional elements. And what a great segue to, the role of self-care in the Wheel of Health. Hanna, tell us all about it.
Well, the Wheel of Health, as you will find on one of the pages in chapter 1, is actually the accumulation of my past, at this point, 13 years of work. When I first started as a nutritionist and then a lifestyle coach and all these things. And this is really a very holistic view on your health. So I don't know if in some life coaching situations, there is this exercise called the Wheel of Life. And this is basically based on that, but this is only health aspect related. So you have things like medications in there, you have mindset, you have nutrition, you have, all of these things that are so important to understanding your health and your condition a lot better. Because you would never really imagine that your mindset has a lot to do with how you do day to day and how you are doing in your daily life. But it really does. It affects your mood, and it affects your maybe willingness to even take your medication, or if you have a difficult period of time or something, and things like sleep and movement as well. And these are things that maybe sometimes are a little bit overlooked when we have the 7 minutes of time with our healthcare providers, a couple of times a year. It's a little bit overlooked maybe. So there is really a huge power in taking this into your own hands and making sure that you are taking as good care of yourself as you possibly can, because that can only help for the rest of your care as well. And because in the end, like we really, even though we are patients, and this is one of our labels, one part of our persona, but we really need to be able to live our lives to the fullest with and despite these conditions that we live with. And we can't, we have to create these partnerships in order to support ourselves through that as well. So I think this it's a very holistic way of looking at things. But read more about it in the book, and always happy to chat about it offline too.
And within the frame of 5P Healthcare Solutions, Hanna offers a very specific 5PEP, 5P patient empowerment program around those 6 dimensions. And she closes very nicely in her chapter saying there's simply so much more that we can do ourselves to improve our health outside of the doctor's office. Thank you so much, Hanna.
Thank you. Thank you.
So if you are curious to learn more about what we can do to support you as neutral brokers, actually, that we act as 5P healthcare consultants in your journey, actually, to healthcare transformation, let us know, because we catalyze those conversations and those projects among providers, pharma, medtech, payers, policy, and patients. And contact us today and let us know how we can partner. And please tune in into the next podcast as they're coming along your way over the next month. Goodbye.